Hi everyone, my name is Meghan Gendzier and I'm a doctor of physical therapy. I specialize in orthopedics, dance and performing arts medicine, and female athlete wellness. I work with Pivot Physical Therapy and we're a proud wellness sponsor of the Charlottesville Ballet. This month, I'm teaming up with Seville Ballet to talk with you all about things like anatomy, posture, balance, and injury prevention. All things as a current PT and a past dancer that I feel will be so helpful for all of you to know as developing dancers. The body and its movements are so complex, and I'd like to teach you some things to simplify it and help you learn about your dancer bodies. Let's start with talking about turnout. It's something you hear about constantly as a dancer. You hear more turnout is better, so everyone tries to do everything they can to get more turnout. Let's start with the anatomy of turnout. Did you know a lot of your turnout starts up at your hips? Your hips need to externally rotate outwards for the rest of your leg to follow into a turned out position. Sometimes when we've hit the maximum range of motion that our hips have, we try to get more turnout from places we shouldn't, like our knee, which really shouldn't rotate on themselves, or our feet and ankles. When I see a dancer forcing turnout at their knees or their feet, I see these joints going into motions that they really aren't supposed to move in. They're not at their most balanced positions. Like these, let's look at some pictures. In this one, the knees are going inwards, and then this one, the arch of the foot is dropping in. Oftentimes, you can get there. You just need to teach your body how. And remember, you might not even realize you're doing some of these compensations. Everyone's body is different, and it's common to have better turnout on one side versus the other, and that's okay. I'd like to go over next some of the common areas of discomfort or symptoms I hear that lead me to check a dancer's turnout posture. Some of these might be familiar to you, or if they're not, they will be good to knows for the future if they ever appear or you notice any changes in your turnout postures. Let's start up at the hip. At the joint level, your femur needs to rotate on the acetabulum. It's like a ball in a socket joint. It does this from the muscles on the outside of your hip, attaching to the outside on the top of the femur. This is going to open or externally rotate the hip on the pelvis. Some of these muscles you might hear are your gluteus maximus, medius, and minimus. These are really just big, medium, and small, and they're shaped like a fan. There are several deeper muscles underneath the glutes that also externally rotate. Sometimes also when a dancer forces a posterior pelvic tilt and really tucks under, it can lead to clicking and popping at the hip. This can put a lot of stress on the ligaments and the tendons that pass through the front of your hip. Let's take a look at a picture so you kind of know what I'm talking about here. Moving down to the knee joint. Trying to get extra turnout can sometimes lead to pain on the inside of your knee, making the medial, the inside ligaments, and joint structures a bit angry. Your knee is a hinge joint, meaning it should mainly do flexion and extension. It rotates on itself just slightly, but it shouldn't do this too much. What I see in the clinic from forcing turnout can be medial knee pain. That's on the inside here. This can cause stress on the meniscus, which is the cushion between your knee joints, or the strong MCL, the medial collateral ligament on the inside of your knee, either from twisting or maybe gapping at this area. And it's really in a way that your knee shouldn't quite be gapped or moved. Other times it can put stress on the ankle, stretching the inside or pinching off the outside of the ankle. You want to think of your ankle bones as pulleys, and the tendons run through these pulleys. The pulleys and muscles and tendons need to be balanced, and they need a balanced space to be strong and function well when you're moving. At the ankle foot, I often hear about pain on the inside of the arch or a pinching pain on the outside of the ankle. Sometimes I see dancers pronate too much or drop their arch to get to a point of range of motion where they have more turnout. This can put stress on the structures on the inside of the ankle and the tendons like the posterior tib, the flexor hallucis longus, or the long toe flexors. I will also hear complaints about pinching or clicking pain on the outside of the ankle, and sometimes this is just from an extra pronated position and it's pinching off that area. This can be from pinching of the peroneal tendons, which helps your foot point, and then also helps in that winging position. These are only a few brief examples of how one position can achieve more turnout and cause more discomfort at different joints. It's often a matter of involving the whole body or several joints in the body versus just one joint like the knee. If you're a dancer, you've probably been told you're bendy or you're hypermobile. This can increase how much rotation your knee has, for example, which is why it's even more important to maintain muscle strength and use your muscles to achieve greater ranges of motion for turnout. Here are the key points we talked about today. Your body individually has a happy place where it is most balanced, making all of your joints, muscles, and bones happy and able to move efficiently. As we grow, this balance point can change, so it's good to check in with your posture every once in a while to help your body's proprioception. We reviewed the anatomy of turnout for a dancer and common areas of your legs that might get a bit angry if you try to get turnout from the wrong places. Lastly, your body is unique to you, and it can be normal to have more strength, range of motion, or turnout on one side of the body versus the other. Keep working at it, and if you're experiencing pain with any of these motions, check in with your teachers or your parents. See if it'd be helpful to see a physical therapist for a movement or an injury screen, or if you need to see Dr. Snyder. You can see a physical therapist in Virginia for up to 30 days without a referral from your doctor, which can sometimes save some extra steps in order to get to me and get better. I look forward to seeing you in person at some point soon, and I hope you enjoyed this informational session. Please reach out to me with any questions you have, and we might even feature a good Ask a PT session in a few months, and I'm really looking forward to that.